On this week's episode, Dr. Rob talks about 5 different methods to treat your sciatica pain.
I'm Dr. Rob at the Springfield Wellness Center. Today we're going to talk about what sciatica is and what it can feel like. Now, true sciatica is where there's a group of nerves that comes together, they come down the hip and go down the leg. So a true sciatica, we would have something pinched near the spine right here, irritating these nerves, and will cause pain all the way down to the foot. Most people who come in saying they have sciatica, it's not a true sciatica. There's a lot of things that can mimic it. We can find where, due to some muscle adhesions in this area, the sciatic nerve can't slide across this area like it should, and it will refer pain down the leg, which will a lot of times stop behind the knee. Or we can even have different muscle trigger points that can refer pain. So if we had a trigger point in this area, it can refer pain down the outside of the leg, even down to the outside of the calf. And with these, there's all of the treatment that we would do with sciatica is really going to depend on what is the actual cause of this. And next, we're going to go over different treatments for different types of injury. I'm Dr. Rob at the Springfield Wellness Center. Today we're using the traction table for sciatica. And if we're using the traction table, usually it's the result of the person having a disc bulge. The disc will kind of bulge out to the side right here. It will put pressure on this nerve, which will cause irritation and pain down the leg to the foot. So the way the traction table is set up is we start at a higher amount of pull, then drop to about half that, move back and forth so that we get a pumping motion into the disc to get that disc back into position. I'm Dr. Rob Calcaterra with the Springfield Wellness Center. Today we're going to be using the laser for treatment of sciatica. And if we have a disc bulge in the back, we're going to have some associated swelling and probably some spasm of the muscles in the area. The laser is going to be really good at getting rid of the swelling and then just relaxing the muscle. And what we would do is just kind of we would dig in with the head and just kind of move back and forth throughout the spine. We'd probably go ahead and treat the entire area, going along over to the side. And I'm just kind of going a little quicker than I would usually do. And then going back across this way. We'd primarily use this in addition to other therapies that we're doing. This wouldn't directly fix like a disc issue, but it can be helpful with the pain and swelling in the area. I'm Dr. Rob Calcaterra with the Springfield Wellness Center. What we're going to talk about today is an adjustment for sciatica. And we're kind of talking about if there is a disc bulge in the area. So say we had this bulging out, it would almost make it to where the joint is leaning like this, and we want to take and kind of close that wedge and bring the joint back into normal position. Usually, if something like this is going on, we have to start kind of low force. We can't do the normal side posture adjustments because a lot of times it's a little too much for people. So we would generally and we just use this drop table where the table comes up, you find the amount of tension, then you lightly just kind of push in and drop. And this way the table would take most of the force. It's going to be a lot easier on the patient. We'd usually do that somewhere to 3 to 5 times as long as the joint is moving better afterwards. That's really what we're looking for. As we kind of progress through care though, we will more likely than not, we start doing like side posture adjustments and doing a little bit more force once the patient can tolerate that. I'm Dr. Rob at the Springfield Wellness Center, and today we're going to look at things that mimic sciatica, and there's usually 2 different muscle groups in the hip where we can find some issue. Now, what we'll do is we're going to start, we already kind of found these on Kayla, so what we're going to do, she's going to bring her leg up. I'm going to have you pull the leg up like that, and I want you to come back down. So go ahead and do that. Back. Again. Back. One more. Back. We generally do that a few more passes, just kind of depending on how tight the muscle is and what all it needs. The second one we would do is if the muscle's kind of trapped along here where it can't slide across, we're going to have her bring the leg up. Once she's here, she's going to rotate the leg down, then she's going to come back to here. So go ahead and bring that up, back, here, back. That feel good? One more. And again, we would do as many passes as it takes, depending on how tight the muscle is for her. I'm Dr. Rob Calcaterra with the Springfield Wellness Center. Today we're going to be talking about an at-home stretch you can do if you're having sciatica. With this is more for if we're having a disc issue or injury in the low back that is causing the pain down the legs. So let's say this is the couch right here, top of the couch, and then here's the front. And what we would do is have our thighs against this part and then calves resting here. So I'll have you go ahead and lay down real quick. Good. Scoot up a little bit, forward. All right, so the thighs should be resting here, calves should be on top. What this is going to do is it is going to stretch the spine a little bit in this direction, which will allow this disc, it'll take some pressure off, allow it to slide back in place a little bit. But if she takes an ice pack and puts it under her back right here, that's also going to get this curve back into the spine, which is going to make things a lot easier. You can move a lot easier when things are back in their correct positions. Hopefully these videos were helpful for you. The big thing with sciatica is we have to figure out what is actually causing the pain. Is it a disc bulge? Is it something pinched in the low back? Or is it something that can mimic a lot of these symptoms? Once we know what exactly is causing it, it's a lot easier to start treating. So these can be really painful for a lot of people. I'd suggest if you're starting to have this to get in to see somebody so we can find out what's going on with it and what we think we can do. So for more information, you can visit our YouTube page or our website at wellnessspringfield.com.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.